I'm Joe Calderoni from Mount Sinai, South Nassau, and I want to welcome everyone here today to this beautiful venue that we're at. We're here for a very important topic, and that is to reveal the results of Mount Sinai, South Nassau's latest Truth in Medicine poll. This is actually the 21st poll that we have done. 8 years ago, we started this public health poll. It's the only public health poll sponsored by a hospital in our area. And the purpose is really simple. It is to gauge the public's understanding of important public health topics, gauge those responses, and then try to provide some insight to an education around those public health topics. So before we start, I do want to thank Beth Page. Linda Arman of Beth Page has been an early supporter of this poll. 8 years ago, we went to her and said, we need a sponsor. This is great, but it actually costs money to do a poll. We hire a national independent polling firm to actually conduct the poll. And Linda Arman stepped up right away at Beth Page, saw the value of what we were trying to do, and they have been underwriting us ever since. And that was before Linda became president of Beth Page Federal Credit Union. So we're very grateful to Beth Page. Also, I got to thank Dave Widmer. Dave, where are you? Give us a wave. All right. There's the Dave Widmer cheering section. Very good. So Dave is a longtime supporter of Mount Sinai South Nassau. He's also a past golf honoree of our golf outing, and I believe he's the only golf honoree to get a hole-in-one during that outing. So he has many distinctions. Everybody knows, seriously, everybody knows that Dave is a great salesperson. But I hope his Optimum colleagues and bosses also appreciate what a great community leader he is. And I really say that very sincerely. Dave really cares about Long Island, and he spends a lot of time beyond what he needs to do for his sales job to really give back to the community. And that's kind of a cliche in many cases, but with Dave, he's the real deal. So I just wanted to thank Dave. He also immediately, when we went to Dave and said, Dave, we're trying to get a venue to reveal the results of the poll, he said, well, we got this great auditorium. So here we are. Thank you to Dave. I think, I got two other people real quick to thank, and that's Dr. Sharma and Glatt, who are on our panel. Dr. Rob Sharma is the president of Mount Sinai South Nassau. Wave, do a wave. Dr. Glatt is the chairman of the Department of Medicine at Mount Sinai South Nassau. And I'm calling them out because they also, 8 years ago, when we came up with this crazy idea of doing a hospital-based public health poll, both embraced the idea right away and have been extremely involved in every detail of it. In fact, they are our clinical leaders when we are trying to devise an idea for a poll and actually the questions, the polling instrument. They are very involved in both picking a topic and designing the questions. So it's a lot of time commitment, and we appreciate their leadership with this. So I have 3 adult children, and the only cell phone problem I have is getting them to pay the bill. So I am going to turn this over to Dana Sanneman, our VP for Public Affairs, who has 2 middle schoolers and has her own tales of woe, which maybe she'll share, I don't know. But I also want to thank Dana because she spends a tremendous amount of time organizing the poll, getting folks for the panel, and just helping us move this thing along. So Dana, turn it over to you.
Yes, thank you. As Joe mentioned, I do have 2 teenagers, and as we were doing the walkthrough yesterday at 2 o'clock here, my 13-year-old texted me and said, don't worry, I'm in art class. It doesn't matter that I have my cell phone here, to ask me when her Amazon order was coming. So I ignored her, but it is a real problem, and I'm really happy we have our friends from Beth Page here. Thank you for joining us, for everyone who is here to learn about this important topic. So first, I just want to introduce our panel. So I'd just like to first introduce all the members of our panel, Dr. Sharma and Dr. Glatt, who Joe already introduced. Then we have Dr. Ron Marino. Dr. Marino is the director of Mount Sinai South Nassau Center for School Health. So he partners with a lot of our local school districts on important public health topics. We also have Dr. Sherry Kami, the superintendent of schools for Baldwin School District. Dr. Helen Kanelopoulos, who's the Assistant Superintendent of Education and Administrative Services at Freeport Schools. And Sylvia, unfortunately, had a last-minute emergency, so thank you to Sue Cools from Baldwin for stepping in as our parent representative on the school board. And just thank you to Baldwin and Freeport for both being amazing partners to Mount Sinai South Nassau. So I just want to briefly run through the results of the poll. So Mount Sinai South Nassau and Bethpage partner with an independent polling company. So LJR Public Strategies polled 600 adults in metro area New York, so New York City, Nassau, and Suffolk County. For this particular poll, they only polled parents because we wanted the opinions of parents who have children. And it was conducted in August via landline and cell phone. Key findings. More than 1/2 of parents have children with a cell phone or a smartphone. And obviously, as the child gets older, the more likely they are to have cell phones. 25% of parents whose children have a phone are not sure how many hours a day the child spends on social media. Parents who did have an idea are reporting at least 3 hours a day. 53% of parents are concerned about the amount of time their children are spending on devices and social media apps. We all know the apps: Instagram, YouTube, TikTok, Snapchat were the most popular. No kid uses Facebook. These are the four that they spend the most amount of time on. 25% less than 2 hours, 34% between 3 and 4 hours, 16% 5 or more hours. So the mean number is 3.41 hours a day on social media apps. Here's a chart to just kind of show the mean, and this chart breaks down the kids' ages a little bit more specifically, and also Long Island and New York City. And here's a bar chart as well that shows it a little bit more clearly. You can see the purple, that's 34%. So a plurality of parents whose kids have a phone say they use all of these social media apps. YouTube is the most used, but that was followed very closely by Snapchat. Here's a breakdown also, and this is important to look at. You can see New York City versus Long Island. There's not a big difference. A lot of times we do these polls and we do see differences from New York City to Long Island. This is across the board, the numbers were very similar. We then pivoted to cell phone use in schools, and this is important. So Governor Hochul over the summer did push through legislation, the first in the country, that monitored social media algorithms on cell phones. She now has announced that she did a listening tour over the summer, and the results of her tour showed that she is ready to move forward with legislation to ban or at least limit cell phone use in schools. So beginning of the school year, New York City Mayor Adams announced plans to restrict cell phone use in schools, but it's currently on hold while they iron out more details. Yesterday, the teachers union in New York City announced potential support. They have a few items that they want to see happen first before they fully support. But the teachers, when they did a survey, revealed that 63% of all teachers in New York City supported a ban on cell phones in schools. In Hempstead, which is one of our local school districts here, their district's new policy prohibits the use of cell phones from the time a student arrives until they leave. So similar schools around Nassau County and also New York City are looking at similar bans. 73% of parents agreed that the schools that they attend are safe. So then we asked them, let's look at cell phone use in schools. And 77% said students should not be permitted cell phones in schools. However, 72% said they want their child to have a cell phone in school in case of an emergency. And I know our school superintendents are going to speak about how you reach this balance of not having cell phones in the classroom, but allowing children access to cell phones for an emergency. And you can see the breakdown down here geographically. Again, New York City and Long Island, almost the exact same, 72% and 70%. There is also support for state and social media companies to limit social media for minors. 85% agree with state laws limiting social media feeds for minors. 82% support that social media companies need to do more to limit children's use of social media apps. And you'll see here that parents with children between 11 and 13 are the strongest supporters of these approaches. And you can see the breakdown here as well. Again, almost the exact same. So although they also asked parents before they started the poll to ask about children, they asked parents themselves how much time they were spending on their cell phones. So parents report their children are spending a little over 3 hours a day on social media, 53% concerned about this time. Only 25% of parents thought this was having a negative impact on their children's mental health. 18% of parents admitted that they were addicted to their cell phones, they themselves. 31% agree that they spend too much time on social media. 65% disagreed. Very few parents believe that their addiction to their phones has hurt their relationships. Children's, not surprisingly, but children's social media use mirrors their parents. So among parents who spend less than 2 hours a day on social media, the children's average is 3. But as that goes up for parents who spend 5 hours or more on social media, the children's average of them spending time on social media also goes up 3.7%. So I'll end it there with the findings. We're now going to just start our panel discussion. Please feel free to ask questions as we move throughout the panel. You don't have to wait till the end if there's something you want to ask. We do have a microphone, so just raise your hand and we'll get the microphone to you. Thanks.
So Dana, before we go into the panel,
Sure.
I just want to make a couple of comments about this study. So when we asked parents about how much time they think their children spend on their cell phones, this was, I would call, a guesstimate. If you really want to be shocked and your child has an iOS phone, there's an app called Screen Time. And if you look at the Screen Time app, you will really be surprised at how many hours your children are spending on their cell phones, and you'll be able to drill down into the specific apps that they're using. I guarantee you it's not 3 hours, which was our average. It's probably somewhere between 8 to 10 hours. And if you see, sometimes it's more hours than people would think they're awake during a day. At night, if they have access to their phones, they're using their phones as well. So again, our parents gave us their best estimates for the survey. But if you're really curious and you have the iOS app type phone, you can check exactly how many hours your child is using the phone. And then on that Screen Time application, there are ways to do parental limits. Again, this is iOS. I'm not an Android person, so I can't speak to what they do. But kids find a way around that. So as much as you think that that app is helping you limit their time, they go through Safari. If there's a web-based option, they go through YouTube and other things. You want them to use their phone to do schoolwork, etc. But at the same time, now they use it to circumvent the screen time limitations. So a lot of what we're seeing is actually underestimating the actual problem. I just want to put that out there first.
Sure, thank you. Just while we have you, Dr. Sharma. So excessive screen time and social media use can obviously have detrimental effects, not just on a child's mental health, on their physical health, on their emotional well-being. When should parents start having a conversation with their pediatrician about cell phone use?
Great question. So it depends on a couple of things. First, what age are you, as a parent, considering giving your child a cell phone? So whatever age you're thinking about that, that's at the minimum, that's the age you should have that conversation. If you see that you're giving your child a cell phone, maybe your own phone from time to time, as soon as you start doing that on a regular basis, you should talk to your pediatrician about cell phone use. The American Academy of Pediatrics has long had recommendations for television time, and then they adopted that for computers to screen time, and you can translate that to cell phone time just as easily. And young children should not be exposed to significant amounts of screen time. If you look at the recommendations for preschoolers, it's about an hour a day and no time before age 2. And I'm sad to say, I've seen toddlers in their strollers with cell phones. I mean, it's gotten to this point where it's so common. Cell phone addiction is a real phenomenon. It's not something, and anybody who has a cell phone can probably attest to that. If cell phone were alcohol, we wouldn't be having this conversation, right? Nobody's giving their toddler alcohol, maybe in France, I don't know. But the rest of us are not, and we wouldn't have this conversation. So we have to be mindful. The body has dopamine. Anything that triggers dopamine can be addictive. Video games are addictive, cell phones are addictive, certain drugs are addictive because of their dopamine properties. So we have to be mindful of what we're doing to our children and what we're exposing them to. So the short answer is probably as early as preschool, but definitely as they're getting into kindergarten is a good time to have that conversation. Because once they get into school, they're going to be seeing cell phones everywhere. And then the social pressure on those kids to demand a cell phone from their parents starts to escalate with each grade that they go through.
Thank you, Dr. Sharma. Dr. Glad, I just want to speak a little bit more about the American Academy of Pediatrics and their guidelines on cells. How would you know your child is being a responsible cell phone user? And how important is it that you have regular check-ins with your child about life other than digital life?
So I think it's critically important in raising children, raising grandchildren. It's critically important to know what they're doing. And I think many people don't really fully understand what their children are doing with their devices. And it's not limited just to smartphones, it's access to any device, anything where they can go onto the internet. There's a tremendous amount of horrible information, as we all know, on the internet. There is a tremendous amount of misinformation, lies, horrible things that we would never want our children to ever be exposed to. Forget the immoralities, forget all the things that are dangerous that could be teaching children to do. You need to be aware as a parent, as a grandparent, you need to be aware of what your children are doing. And when we were growing up, your parents knew where you were going. We don't have any clue where our children are going if they have a smartphone, if they have access to the internet. And it's incumbent upon parents, grandparents, who's ever taken and watching these children to make sure that their children aren't going to sites that are inappropriate. We've been talking a lot about the time that children are spending on their phones. 5 minutes of a very, very bad website is not acceptable because they're only spending 5 minutes there. 1 minute, inappropriate things that they're seeing, inappropriate ideas that they're being exposed to, dangerous, harmful, potentially atrocious things that they're being exposed to. There's nobody telling them, no, that's not correct information. There's nobody telling them that's okay, that's not okay. They're seeing things. Some of these are done very, very professionally. Some of them are done with tremendous amount of enticement to continue watching, continue exploring these absolutely inappropriate for adults, certainly for children, whose minds are so malleable, whose minds are so inquisitive. And for a parent not to know where their children are would be the equivalent to when I was growing up and my parents didn't know where I was at 8 o'clock at night. As a 5-year-old kid, if you don't know where your 5-year-old kid is, you're not a very good parent. Well, if you don't know where your 5-year-old kid is, even though he's in the house and you know he's in a room and a closed door, looking at things that you don't have the ability to watch, they shouldn't be behind closed doors. They should be in an area where somebody walking by can see what they're looking at if you even let them look at it. I'm going to probably give an opinion now that is not the norm and is certainly not something that anybody in this survey that we did suggested. I don't think it's appropriate for children to have a smartphone, period. Not in school, not outside school. And I think that peer pressure is unfortunately going to make my opinion not be easily carried out. But I think it's dangerous. If you want a child to have a phone for safety, they make phones that aren't smartphones. You want to know where your child is? I understand that. I want to know where my children or my grandchildren are. They should have access as age appropriate to a phone, but not necessarily a smartphone. And I know that'll be a very, very minority opinion, but I think it's actually the safest opinion.
Thank you, Dr. Glad. Dr. Marino, I do want to come back to a family media plan, but I just want to first hear from some of our school superintendents, just to Dr. Glad's point. Freeport and Baldwin, what are your current school policies about cell phones in the classroom and cell phones in the schools?
Thank you, Dana. So in Baldwin, we do not allow cell phones at all, K through 8, kindergarten through grade 8. And in high school, they are not used in classrooms. They are only allowed if students are at lunch. There is so much to say on this topic. The first, I think, is that while we're looking at a law banning cell phones in schools, the real issue is not in school, it's outside of school. And so I'm a big believer in getting to the root of the problem, and the root of the problem is not school. The root of the problem is access to this and when and where it's being used. You would not allow, to your point, a young person to drive without driving lessons and without taking a test, but we give a $1,500 device into the hands of little kids. You mentioned about students in strollers. Well, when those little kids in strollers are looking at the device, generally their parents are looking at a different device. And so it is clearly an epidemic. It's clearly something that as a community, we have to tackle together. Asking schools or creating a law to ban it in schools really just gives us the ability to say to kids, it's against the law. But in 78% of schools around the country, it's already not used in school, in classrooms. So I think we need to really be talking about the root of the problem. I would also say that I would agree that the estimates are low, particularly in the adult numbers and adults admitting that they're addicted to cell phones. And so I think a number of things can be done. We are doing a number of those things in Baldwin, but I know those are come up a little bit later in the panel.
Thank you.
So we're actually not really getting any pushback at all. It is the norm. It's what is accepted. Just like anything, do we have 100% compliance at the high school level? We don't, but we also don't have 100% compliance with homework. It's something that we tackle every single day. If we had 100% buy-in of our parents, which mostly we do, it's just a much easier road. And I think the best example of that, our biggest issues that we have are on Mondays, and they're after holidays. And they're on Mondays and after holidays because our kids have been home on their cell phones, on their devices, on social media, unrestricted in many cases. And when they come back to school, then it becomes the school system's job to deal with what went on when kids were not in school.
Thank you, Helen. I want you to touch on Freeport and what their policies are as well. But also, I know, we developed strong relationships during COVID, and, my kids packed their backpack, they packed their lunch, and they also have their smart books and their Chromebooks in their backpack. So what impact did COVID have on cell phone use in schools and outside of schools as well?
So in Freeport, we have a similar policy, not allowing K-8 to not have cell phones. We do need to tweak our policy a little bit. But right now, students are allowed to bring cell phones to school, but not have them out. But, I think we need to find a balance similar to what Dr. Kami was saying. There's a problem, and we need to educate our children on the problem. I don't know that the solution necessarily is taking it away, but teaching them how to properly use it, because not only is it expensive, it's also a powerful tool that they have in their hands. And I think COVID really did damage on our kids, where that was their only tool to connect to the world, to their friends, to their family. So then we had to teach them to unlearn everything that they learned during COVID, Zooming with family friends, using social media to connect with their peers. So now it's about unlearning what they learned.
Thank you. And Dr. Sharma, I know we were speaking about this earlier, but when should a parent be concerned that their cell phone use, both in school and outside of school, is having a negative impact on their mental health?
So unfortunately, it'll probably be late signs that manifest by the time the parents are going to get concerned. There was a study that looked at self-harm and suicidality in teenage girls over a 10-year period and found a 30% increase during that period with cell phone usage. So when that happens, unfortunately, it may be too late. So what you are looking for is increased time spent on a phone, decreased time spent doing other activities of interest. Are they not getting outside? Are they not getting exercise? Are they doing their homework? If they spend 3 hours on their homework, Dr. Cami would be so thrilled, as opposed to 3 hours on social media. Are their grades slipping? Are they becoming moody? Is their appetite changing? All the typical signs you would see for what we would call depressive signs or signs of isolation, which we all saw significantly increase during COVID, as was mentioned. But certainly, if that's what's happening, then one of two things is happening. Either they're spending so much time on their phone that they've isolated themselves from the rest of the environment, or they're socializing on the phone, which is also common, and the impressions they're getting are negative. And that can happen in one of two ways. One, there can be people who are bullying them or trolling them online, and that can be having a negative effect. But there's also this FOMO effect, this fear of missing out. And we can't underestimate the impact of that as well. And what happens is they see the ideal life on social media. Everyone posts their picture of them and their perfect vacation or the perfect dinner that they're having or whatever they're doing. And now you feel left out because you don't have those things. Well, the solution to that is to going out and doing those things, not sitting and watching more pictures of other people doing it. And so for adults, for kids, they don't have the ability to do that. So what happens is they get more and more down on themselves about the life that they're living. So any of those signs that you see, trouble sleeping, trouble engaging with others, these are worrisome signs. You should keep an eye out for them in any case. It doesn't even have to do with cell phones. This is just a general parental lookout that you should be on. And certainly if you see any worrisome signs, reach out. There's a lot of sources to get help. The schools have sources. They're a great source for resources there. And then also your pediatrician, your physician, mental health counselors, any resource that you think your child needs, you should make sure you reach out to those resources.
Thank you.
Just to add on one thing, that's a superb overview. I just want to focus on one additional thing. Besides the mental, there are the physical detriments to cell phone usage. You're a couch potato. You're not moving about. And we are seeing a wave of obesity in younger children. Again, not to throw back when we were growing up, but when we were growing up, all you did was go outside and play. There wasn't as much to distract you. And the internet phones are very attractive. And it's a lot easier. It doesn't require any effort to sit there and watch somebody else playing ball instead of you going out and playing ball. And we're seeing a wave of obesity in younger children, and we're seeing it in adults as well. And the numbers are astounding, and the medical complications that come from that are going to unfortunately haunt us for years to come.
Thank you, Dr. Glatt. Dr. Marino, just now is probably a good time to talk about a family media plan. When is a good time as a family to sit down and talk about a family media plan, and why is it important?
Well, I think if you don't know what a family media plan is, it's actually a formalized way of discussing the use of screens and cell phones in your family. The American Academy of Pediatrics has a site that's available for parents and anyone to go on. It's called healthychildren.org. And there's tons of information there about not just cell phones and family media usage, but anything you want to know about children and their health. The family media plan at this site helps you to within your value system of your family, because everyone's values and what they want with regard to cell phone use is different. But you register for this and you sign up to discuss all your children's names. You put that in there, you put your names, and then you make commitments to what's important to you. How much screen-free time do you want? Is it okay to have phones at meals? What are your values? Are you most concerned about cyberbullying? Are you most concerned about respect on the internet? So it really takes a detailed profile of your values, and then you can say with your family, let's go over this. Let's talk about this with our 3-year-old, our 11-year-old, our 18-year-old, mom and dad. Everyone makes a commitment to discuss openly what their feelings are and what their values are. And you can actually print this out and discuss it among the family. So that's a family media plan. And it's, like I said, healthychildren.org is a wonderful resource to go to and help you construct that family media plan.
Thank you, Dr. Marino. I just want to go to our, oh, go ahead, Dr.
Yeah, just one quick comment. The family media plan is really important. You know, there's this expression, that which we permit, we condone. And as parents, we have the control over what we allow our children to do. What we allow them to do is what they'll think is acceptable. And Dr. Cami mentioned how it's normalized in the schools that they don't have their cell phones because that's the policy. They've enforced it, and the students say, okay, this is normal for us in this environment, and they've accepted that. Clearly, we can do that at home as well. It does require supervision. It requires you to sometimes be the bad guy, and it requires energy because anytime you make a rule, you have to enforce it. And some parents are very busy. Some parents are working 2 jobs. They may not have the ability to do this, but if you decide to do a family media plan, you have to commit to it, and it has to be every day because the second you start to slip, then you've condoned that new behavior, and the kids will quickly adapt to what they enjoy. Trust me. And we will end up having the family media plan fall by the wayside.
I think, role modeling is so critical because we can't say you have to get off your cell phone. You shouldn't be on TikTok. And we're sitting there on Facebook or just scrolling through different things. So role modeling, we have to abide by that. And the addiction is real for adults as well as kids.
Thank you. Sue, I just want to ask you, and I want to go back to our school leaders as well. So 2 things as a parent, as a grandparent, what concerns you most about your child's cell phone use? And then also what steps would you like to see your schools take as in regards to cell phone use in schools?
Well, what concerns me the most as a mother and a grandmother, so my youngest child is 32, and every day I have to throw out a comment here or there to put your phone down, stop looking at your phone, which annoys him because he's 32. And, as well as my 6-year-old granddaughter who just wants to watch things on her tablet, which I didn't buy her, by the way. It is so concerning on so many levels. And, eventually, if something is not done about this, as we all fear, these kids are not going to have any social skills whatsoever. And I think that we're already seeing that, which just adds to more and more conflict, which is the last thing that we need. I know in our school district, I do believe that we're doing everything that we can possibly do. And because we have a very creative superintendent, we do go even above and beyond. Over the summer, our superintendent, Dr. Cami, had a program called Baldwin Street Games, where one evening all families were invited to go to their prospective schools with their families, no cell phones allowed, and play street games for hours. And at first people weren't sure what to think about this, and the calls and the emails didn't stop for weeks afterwards. People thought this was amazing. So you can get creative, and there are things that districts can do, but with anything, I think it always comes down to communication and education, not just with the children, but with the parents. Many parents do not realize the actual statistics. They do not actually realize that there are tools they can use to help them say no, to help them educate the kids on the damage that this can do, and educate their kids as well. And I think that that's the most important thing that we can all do.
Thank you. Sherry, I just wanted to ask, it was in the newspaper last week about Kallenberg. They, the first week of school last week, and there were bomb threats. So how do you balance parents wanting their kids to have a cell phone in an emergency, but then the school telling them to keep them put away?
So I'll answer that. And then if you don't mind, I just.
Oh, yeah, of
go
course.
back. So in an emergency, the last thing that kids are supposed to be doing is being on their cell phones. You see that from some of the traumatic events that schools have had to deal with. In Sandy Hook, for example, in Parkland, ambulances and emergency vehicles could not get to the school because all of the adults flooded the school trying to get there. So the number one rule is to actually be off your cell phone. You don't want phones ringing. If God forbid there is an intruder, you don't want phones ringing. You don't want clicking on cell phones. And so it is, I know, the exact opposite of parents' instincts, right? We're all parents. We all want to know that our kids are safe, but the rule is to do exactly the opposite of what parents want to do. But if you don't mind, I just want to go back for a minute. The idea of Baldwin Street Games. So I'm a kid who grew up in Brooklyn, probably similar to as you described. And when we were kids, we would just go out and play, right? We played stoop ball, we played paddle ball, everything that needed a little pink ball or a piece of chalk, and it didn't require anything else. When we did Baldwin Street Games, we had over 700 kids show up for this. And that included their parents, and nobody was taking pictures of their kids playing, jump rope, complete ban. And the feedback was so incredibly positive. So sometimes the leaders need to show what's possible. And it was incredibly positive. But one of the other things that we're doing in Baldwin, as are some other school systems, embedded in our ELA and in our social studies courses, grades 6 through 12, is news and media literacy. Because if the kids are going to be on those phones or on those devices, they need to know how to distinguish what's real from what's not real, right? We all know that when you click on things, it creates an algorithm that then redirects you to a very similar message. And so now you're in this dark hole of one opinion or one viewpoint, and you need to know that so that you don't get lost in that dark hole. And so we do news and media literacy, grades 6 through 12 in ELA and social studies, and we offer a college course through Stony Brook on exactly the same course for our 12th graders. In part, that is how we define civics, right? You hear all this talk about we need to go back to civics, we need to go back to civics. Step one is define what that is, and that's being a good citizen. And so how can you be a good citizen if you don't define what it means to be a good citizen, and if you can't tell the difference between what's real and what's not real? And so schools, I think, play their part in where it is appropriate, but I think we can't forget that this is not a single institution issue, right? It's a societal issue. The other thing that I just want to share is, so I have 2 grown kids as well. And I remember once, and it's probably 15 years ago now, we went on a cruise as a family. And I said, we are not doing a data plan. Not only don't I want to pay for this data plan, but I don't want you on the cell phones while we're away. And so all cell phones were off during that time. And then, of course, you pull back into shore at the end of the cruise, and everybody turns on their, like, there's literally a deck full of people that are desperately turning on their cell phones. And I remember my son saying to me, and he was in high school at the time, he said, Mom, I'm so thankful that you made us turn off our phones, because the flood of, his word, nonsense that came through when we got to shore just allowed him to see the difference of what's real and what's just fake, really. And I think sometimes we just really need to, as parents, as educators, as citizens, just as people, need to present an alternative viewpoint to the young people. But we have to buy that. We have to buy into that ourselves, because our kids' social lives are completely dependent on that device. They make plans that way, whether it's through a text or, God forbid, Snapchat, which I think is the worst of all of them. And there just does need to be some regulation, I think, on the side of technology, because our parents feel immense pressure because of their kids' social life to allow their kids on devices.
Thank you. Helen, I do want you to talk a little bit about Freeport's policy as well. But what else do parents, you're their teachers, you're their leaders. What other concerns do they share with you about cell phones in schools?
I mean, the main concern is really safety, that during a time of crisis that they want to be able to reach to their child. And similar to what Dr. Kami said, unfortunately, over the last few days, we had similar threats in our school. And the parents, it's now us trying to educate the parents that when there is a crisis situation, please don't come to the school because you are in the way of the investigation, right? Unfounded threats, non-credible. It caused a lot of angst amongst the parents and then also the students, because we're directing the students to do something and then the parents are directing the students to do something else. So we do understand that they want to be in touch with their child, but also we need to do our job to keep our children safe in the school.
I want to kind of ask everybody this, and then I want to open it up for more questions. But, as I mentioned, the governor has said that she will introduce legislation in January regarding cell phone use in schools. So just kind of want to go down and you can just answer it quickly. Do you support laws limiting and regulating both social media feeds and cell phone use in school? Start with Sue.
I definitely support laws limiting social media feeds. There has to start being some accountability to the damage that's being done. Absolutely. As far as laws banning cell phones in schools, it can't hurt. I'm not 100% sure that there needs to be a law for absolutely everything. Again, with more communication and education, the school districts are able to mold their own plan that fits their district and do what is best for them. I'm not 100% sure whether or not that actually needs to be a law, but the social media companies definitely need to start being accountable.
I agree with the social media ban. Our students and children are out there surfing all different channels on social media. You know, the complete ban, I'm not so sure as well. I think having that local authority to be able to do what you need to do for your school district is truly important. And again, the education and communication is really important at this time to really teach children how to use them.
So I would say the devil is in the details. I would need to read the law. The issue is not, in my opinion, is not in school. It's outside of school. And so you can create a law. It gives us something to fall back on. But the real issue is the use of social media, the use of cell phones when our students are not in school.
Yeah, I agree with everything that's been said. I won't disagree that they are going to be helpful, but they're Band-Aids. They're not really addressing the root of the problem. The root of the problem is we need laws to regulate those that we cannot control, and that's all the social media companies. Our kids are subject to what they're exposed to. We have the ability to restrict phones in schools, and it seems very effective. We've heard that. We as parents have the ability to restrict screen time at home to some extent, but what we can't really control is what the content is that the kids are exposed to on a regular basis. So the laws that will redirect the social media platforms, the use of algorithms, and sadly, I think the ultimate solution is actually going to be an AI, because since we can't police our kids every second of every day, we're going to need a tool that does that, and that's where that'll likely fall.
So I agree as well. I think that anything that we can do to minimize the amount of time that children and adults spend wasting their time on social media, things that aren't for true educational benefit, things that are biased, anything that we can do to limit the exposure children and adults to that is certainly beneficial. I know the answers are obvious, as the way to implement them is not so easy. The answer is simple. Yeah, there's not a single person in this room that wants anybody to be exposed to inappropriate stuff. But that's all the internet is. It's inappropriate stuff. And parents have to take responsibility. We can't dump everything on the schools. Children spend more time at home. And you heard the weekends and the coming back after summer vacation. It takes them a month or two to get the children back into an educational mode after summer vacation. It takes till Tuesday, Wednesday to get them back into the mode after each weekend. So we are destroying our children's potential. And that's something that should be of grave concern to everybody. And the answer isn't the Band-Aids. The answer has to be a much more dramatic approach by parents and grandparents to limit themselves what they do with the internet and to make sure that there are filters on phones. There are filters available to only allow access to sites that the parents approve. If you are going to that step of having a smartphone. Now, reiterate my very minority opinion. I don't think children should be having a smartphone 24 hours a day, 7 days a week.
I think schools are a place where children should focus on learning and socialization and not in-person socialization. With regard to laws, there are benefits to having laws. And as Dr. Kami said, to say to a child, this is the law. We saw with bike helmet laws that when bike helmet laws were passed, bike helmet usage increased, it doubled. Still not where it should be, but parents could say, you have to have a helmet. It's the law, you must wear a helmet. Similarly, when seatbelt laws were passed, they're effective means of changing culture and giving parents and other people in an authority position to say, this is the law, you should follow the law. So, but I do think schools are a place where we need to find a way to keep kids off phones and away from phones so they can do what's appropriate in school, and that is learn and socialize in person. Laws may help. That still, as you said, the devil is in the details, and we'll see what the law says.
I do want to open it up to questions, but I'm just interested, a show of hands for people in the audience who have children, who supports a cell phone ban in schools? Pretty significant. Thank you. I think we have one question over here. We'll bring the mic up.
Hi, I actually have two questions. One is more simple for Dr. Kami. I think your name's I work at East Rockaway High School, and I'm just curious what curriculum you use for the ELA and social studies media literacy, or if teachers just kind of created it. And the second one was for any of you, if you've heard about the Wait Until 8th campaign, because many families are afraid to take social media away from their children because then they will be left out of making plans, like you said, which can then lead to their child being left out, having depression, et cetera. So there's a campaign that is for communities to say, okay, wait until the end of 8th grade to give a smartphone, wait until 16 to give them access to social media so that everyone is involved, so that no one's left out of making plans. So I'm wondering if anyone has heard of that, what you think about it, and how we can maybe, or how you would be helpful in spreading that campaign.
So the curriculum is a curriculum that we've written, but it's based on, it's a partnership with Stony Brook University, who has a news and media literacy program. So that is a very strong partnership for us. In terms of wait until 18, you know, yeah. There are some getting them in kindergarten. We've heard of that. I mean, I will say I'm in support of that, but I go back. So when you sign up for something and they want to make sure that you're 8, you know, you're in 8th grade or you're 18 or whatever age, you go to the age and you flip to say what year you are. It's frightening that I have to flip so much these days to get to the right year, but it's based on the honor system. And so it goes back to what I think we're all saying, which is that there are ways around everything. Dr. Sharma is exactly right in that even filters that are out there, the minute there's a filter that's introduced, there's somebody else that's come up with a way to get around the filter. And so it has to be more than just. Yes. And so creating an alternative for those parents, I think, is what's important, where the Baldwin Street games came from and things of that nature, because I think we just need to redirect their attention somewhere else and show them another way of doing things.
Just a quick comment on that. So to go back to what Dr. Marino mentioned, those campaigns are really important. And those are social campaigns that we're trying to do in our communities. But laws would help facilitate those type of campaigns. So laws on social media as a cutoff for age, just like we have cutoff for driving or tobacco use, et cetera. There's enough data to know that social media is harmful, and there's no reason for us not to regulate it the way we would regulate anything that's harmful to our children. So I think that's where that would be helpful. It standardizes it, and it gives the parents a 100% bulletproof excuse. They're not being difficult, they're not being mean, they're not being out of touch. They are simply following along.
Thank you.
It's just one more comment.
Oh, sure.
So I fully agree with your idea about cell phone free. And people should be aware that there are schools that don't allow their students to have cell phones, including in high schools. So that is inappropriate, and there's no peer pressure. If none of the children have a cell phone that's a smartphone, so then that's a very, very simple solution. Those children know how to socialize well. They usually don't get into trouble that you see in groups that do have smartphone access, and they perform extremely well academically. But it's a parent's choice where they wish to send their children, and it's peer pressure. It works both ways. If the school's policy, if the parents don't want their children in that type of an atmosphere, then parents can move with their feet, and parents can be very vocal and stand up for what they know is correct and not give in to peer pressure.
Hi, it's Dave Widmer from Optimum. First of all, thank you, Mount Sinai South Nassau and Beth Page Fellow Credit Union for the community leadership of bringing topics like this to the forefront. Yes, I'm well known as hitting a hole-in-one at the golf outing years ago, but in my personal circles, I might be more well known as the father of 6. And so this is an observance I've had over the years. I have 6 children. They span 34 years old, twins at the top, to 13, to 21, excuse me. So there's a 13-year gap between the oldest and the youngest. So the oldest were born in 1990. The iPhone came out in 2008. So what I see a difference between my 34-year-olds, my 32-year-old daughter, and my 28-year-old son is a vast difference in literature embracement. My oldest children are voracious readers. They're writers. They love culture. They know authors like I know musicians, and they actually can read into that literally. My youngest, Tommy, who's 21, a senior at Fairfield, and my daughter Tessa, who were born in 1990 and 2003, respectively. So Tommy was 5 when the iPhone came out. Tessa was, a 9, I guess you could say it. I see a marked difference in their embracement of linear literature. We joke in the family that other than getting Tommy to eat a vegetable, we try to get him to read a book. And seriously, even things like Harry Potter and Game of Thrones and fantastical types of literature seems not to resonate with him. And I'm also concerned about attention spans. The ability to be able to hold a conversation for a period of time. So that's more an observance and a reinforcement to what you guys are talking about. I don't know if you want to comment on that age difference of people born prior to 2008, because of course before then we had razors and phones and things like that, but not certainly to the degree that the iPhone was. So that's my comment on that.
So Dave, I think it's an astute observation on your part. Obviously, you live with it. We were having a conversation about this issue just earlier, late last week, and I forgot who had mentioned this. They had done a small study on 10 kids. They got 10 kids to volunteer to give up their phones. I think it was for a couple of weeks, and they paid them $400 to do that because they wouldn't get anybody to volunteer otherwise. And they took away their phones, and they had no phones for that short period of time. I think it was about 2 weeks. And after the end of the 2 weeks, the kids reported feeling happier, spending more time outside, getting more exercise. So it is generically healthier for us to detach ourselves from our phones on a regular basis. The phones are a great source. They're a great tool. They're very powerful. Yes, there's a lot of misinformation on the internet, but there's a lot of great information on the internet. And as a study tool, they're tremendous because they're kids who will learn better because of the interface of the phone. It's all about balance. It's all about finding that sweet spot. And I think that's the challenge that we really don't have a good solution for today. We do need to work to get to that. And when we do find it, it will be a hallelujah moment, I think, for all of our society. But until then, we are going to have to struggle with these conversations. That's the first part. Absolutely.
So I want to add to that. So you have 6. I invite you to have 3 more because the reason. So there is clearly a disparity between kids born well in advance of the smartphone and kids who are born in that range that you gave. But I do think because of this conversation, you're going to see another difference between our youngest kids now, because the awareness is there. We were kind of blindsided, I think. Things happened without notice. They happened without input. And time goes by quickly. And so we, as we are having this conversation, communities are having conversations around the same topic, that this is harmful to our kids. There is a lot of really good information out on the internet. You need to be able to decipher one for the other. It is true, I think, that attention spans are completely different now than they were. I think your youngest kids could probably read Harry Potter in 1 or 2 page increments. It might take a lifetime to get to the end of the book, but certainly attention span is an issue. But I think that because we are having this conversation, our next generation of kids will have a different experience with the technology than that generation that fell in the middle.
I just have one other question for the audience, and then I'll open it up for final questions. But do you, as adults, do parents in the audience think that their cell phone use sets a bad example for their kids? I'll be the first to raise my hand.
So if you want to teach your kids a good lesson, and I do this all the time, I leave my phone at home and then my kids trying to reach me and there's 75 texts. Where are you? Are you okay? What's going on? And I just say to them, I left it home. And there's this dead silence for a minute because they cannot believe someone actually left their cell phone at home. And worrying about me, I think, is a good thing, right? It shows they care.
Right. I actually would encourage my school district to confiscate my kids' phones for cell phone use too. Just any final comments from any of our school leaders or?
If I could quickly, I would just like to say that I think that Dr. Sharma had raised a very good point that many parents don't think about. Well, he raised many good points, but, and that is to physically take the phones away every evening. Do not let your kids go into their bedrooms with their phones because you tell them it's got to be off. You're not allowed to have it. But when they're still awake at 2 a.m. and you're sound asleep, you have no idea what they're doing, for how long they're doing it, where they're perusing. And I think that that is very scary and very damaging.
Thank you.
That's a great point. I mean, as a practicing pediatrician, I see sleep deprivation as a major problem, and kids are having all kinds of mental health issues and inability to attend school because school starts early and they don't want to get up early because they've been up all night on the scrolling through things and communicating with friends. And they admit it. I mean, kids come to me and say, yeah, I don't go to sleep till 3 a.m. and I get 3 or 4 hours sleep at night. That's a real problem. So it's a tremendously good point to not have the phones in the bedroom.
Any other questions from the media? Jennifer, anybody else?
Make one last comment.
Sure, Dr.
So, there's something we lived. My wife and I, we have 2 boys, and when they were younger, they had tablets or the iPhone Touch or whatever. We literally bought a safe, and we would lock up the devices, and they had screen time. They were allowed 1 hour a day or whatever it was. We would set a timer. They would get their devices, and then when that time was up, we would lock them up again, because anybody who's ever tried to hide a Christmas present knows your kids are going to find anything you hide. So the only way to do it is to put it under lock and key is what we decided. Everybody has to figure out what works for them. But by doing that, we did restrict their screen time in a way that we knew was 100% enforced. So it does require effort. It does require supervision. And then when they need their phones, I tell my wife, go get the key. She tells me to go get the key, right? So nobody wants to actually get up, but it has to be managed. You have to commit. And it worked. It worked for us. Everybody's household is different, and it may work in different households differently. But again, parents have to commit to whatever plan they come up with, and then it has to be enforced. And if we can do that, we can certainly help our children lead better, healthier lives, have better mental wellness, and be better socially oriented as they go out and as adults into society.
Thank you. Cecilia, Greg, anything else? Any final questions? Well, thank you so much for joining us. Thank you, Beth Page. Thank you to our host, Optimum. I think this is an important conversation. And we will actually post the full panel. It'll be posted on our YouTube page later on in the week. So just look out for that too. Thank you for Yes. Oh, yeah, I forgot to tell you that. Thank you.